Hi, my name is Dr. Thomas Incledon. I'm the Chief Scientific Officer at Causenta Wellness and Cancer Care Center. Today's cancer myth buster is all genetic testing is the same. I was pretty excited when I thought about doing this particular myth buster because I speak to anywhere from dozens to hundreds of people each week. And every single patient that we have spoken to at our clinic, when they come in and I ask them, do you know how many genetic tests you've had done? Everyone says, I'm not sure. Some people might say, I think I had 10, maybe I had 70. And so what I like to do is an exercise with them where I actually pull up a computer screen. I have it projected to a monitor so they could see it in like a much larger size. I just show them how I type into Google, how many genetic tests does Guardant Health 360 test for? And another search, another tab would be another search, how many genetic tests does Foundation search for? And then another one would be how many genetic tests does Tempus search for? And what I want them to see with their own eyes is that the different labs do a different number of genetic tests. And so think about if you have cancer of some kind and a lab is going to do the genetic testing, do you want the minimum number of tests or do you want the maximum number of tests? And people would say, well, what does that matter? What is that telling me? Well, think of it in this regard. If you only had 70 genetic tests, and let's say they're all negative, then your doctor doesn't have any basis for treatment. They don't really know what's driving that cancer. They don't know the mutation or mutations. If they had 648 genetic test results, the odds are much higher they're going to find some specific mutations for the cancer that is in your body. And because they have more findings or more information, they now have a better chance of finding therapies that will actually help you. So all genetic tests are not the same. The number of genes that are tested for by the different labs varies considerably. Some labs doing 3 tests doesn't compare to labs doing over 600. And the reason why it matters to you as a patient is once you have those reports from your physician that tells you here's the specific mutations that are in your cancer, that gives you more opportunity to see if there are FDA-approved therapies that could help you, basically you see an oncologist and they prescribe them for you. 2, if there is no FDA-approved therapies, other research studies underway where they're investigating a specific substance that could help you. And then 3, you could look on databases like PubMed or some other medical database and see, are there exercise protocols? Are there supplement regimens? Are there specific diet protocols to follow that can actually target those genetic mutations and help you create a better army of weapons to fight that cancer? So I hope you enjoyed this information and I hope you find it useful as you do your very best to beat cancer.